Okay, thank you, Danella. The words of a presidential candidate recently sparked a debate about whether the federal government should develop ethical guidelines for in vitro fertilization. Joining the debate today are Dr. John Gordon with Dominion Fertility and his patient, Kaet Ruffner. Welcome. Good to have you both with us. And the result of one of your test tube baby attempts was actually very successful, as we can see right here.
That's right.
Wonderful. Well, thanks for coming. Let's start with Speaker Gingrich's words. He says, if you have in vitro fertilization, you're creating life. And therefore, we should look seriously at what should the rules be for clinics that do that, because they are creating life. Dr. Gordon, let me start with you. Do you think that there is enough oversight for in vitro fertilization at this point?
Well, certainly there is a lot of oversight in terms of what we do, both in terms of the CDC, the Society for Assisted Reproductive Technologies, and the American Society of Reproductive Medicine all have guidelines regarding how IVF should be practiced, and in particular about how many embryos should be replaced. And that's really one of the biggest things that we face, because we're victims of our own success. Twin pregnancies account for almost all of the morbidity associated with our procedures.
Well, and Kaet, and it's okay, we're very glad to have him. Tell us who you got with you.
This is Lennox Glenn Ruffner. He is our second child. He was conceived via natural cycle IVF, and our first child, Nolan, was conceived naturally.
And you are pregnant now?
We are pregnant with our third, 16 weeks.
I'm excited about that. Well, you've heard, and you knew when you were coming, we were going to talk a little bit about the Gingrich proposal that there be more government intervention. Would that have bothered you if there had been more process for you to go through in order to seek out in vitro fertilization?
Because we did the natural cycle, it wasn't really necessary, because you only have the one egg. So there's nothing that you need to freeze. The debate wouldn't have applied to our situation, because we did choose the natural cycle IVF over the stimulated.
So, Dr. Gordon, I know that that's what you do a lot at Dominion Fertility. Tell us what natural cycle IVF is.
Right. Well, actually, the first IVF baby in the world was Louise Brown, and she was conceived in 1978. And actually, that was a natural cycle. The one egg that was growing was removed, fertilized in the dish, that means in vitro, and then transferred back in uterus. Now, we got away from that because it wasn't very efficient. And in 2007 at our clinic, we revisited the idea of using just the one egg that a woman normally produces without using fertility drugs.
How efficient is that? How often do you get a pregnancy out of just the one egg?
That's a good question. So what we saw is in our patients under 40 years old, 20 to 25% of successful egg collections result in a pregnancy, and 30 to 35% of embryo transfers result in a pregnancy, which compares actually very favorably if you look at putting back one embryo from a stimulated IVF cycle. But it eliminates these issues of the extra eggs and the extra embryos, which has a lot of people concerned, and actually prevents a lot of people from seeking care, because they want one child. They don't want the ethical responsibility for embryos that might be kept in a freezer, and that's a problem for some of them.
Is it less expensive to have the natural cycle as opposed to having you take several eggs and reimplant them?
It is, and we recognize that it may not be as efficient, so therefore we price at our clinic natural cycle as a third the price of stimulated IVF, costing less than $5,000 for an attempt.
So one of the concerns Mr. Gingrich has is that the number of frozen eggs that could be destroyed, the frozen embryos actually, not frozen eggs. Tell us about that. How many do you usually, or what do you do with those?
Right. Well, this has been looked at, and if a typical patient produces about 11 to 15 eggs, they may have 3 to 5 extra embryos that may be frozen. But interestingly, when this has been examined, most of the embryos that are frozen in the country are actually being held by patients for them to use in the future.
Is that what you would have done? Had you done it that way?
Had we done it, absolutely. Whatever you took out of me, you were going to have to put back in at some point.
Well, we are so glad that you could come, Kaet, and very happy to have you come and respond to Speaker Gingrich. It's a debate that I'm sure that will continue. And thanks for bringing the baby. We wanted to see the result of that. In fact, we have a fake picture of it, but I don't think we can see it close enough. But thank you for bringing it along. It is now 11:40.